This is GP Chat, the automatic generation of easily readable visitation summaries. Patients with multiple long-term conditions face multiple health challenges and have to make many visits each year to different doctors. For healthcare providers, the interaction between their long-term conditions makes managing these patients more complex, so their care plans become increasingly intricate. Many patients struggle to keep track of all their healthcare interactions and instructions, and this often leads to suboptimal patient experiences and poor patient outcomes. Patients need more accessible records, an ongoing care plan, and better explanation of their visits in simple, clear language that they can easily understand. Patients like Reggie, who have multiple long-term conditions, find their short consultations with the GP confusing and often forget critical details about their treatment plans. Reggie is a 58-year-old male with multiple conditions including obesity, diabetes, heart disease, high cholesterol, atrial fibrillation and angina. He has difficulty remembering all the medications that he is prescribed and doesn't always understand care plans that his doctor has outlined for him. He's confused on how to manage all his health conditions. A better communication between patient and doctor can be obtained by summarising the doctor's notes into a plain English summary with key next steps. This plain English summary will be generated using a large language model. Depending on the patient's preferences, this can be handed to the patient by the GP or viewed and accessed in an online portal. It can also be succinct, just giving the key messages and instructions, or produced in an expanded form for patients that want to know more about their conditions. This storyboard illustrates the workflow using Reggie as an example. So Reggie visits his GP, Dr. Tom, to hear about his recent blood test results. Tom's assistant has measured Reggie's blood pressure in the waiting room and found it to still be high and needing further treatment. Reggie and Dr. Tom discuss his high blood pressure and the fact that his cholesterol is still on the high side. So the GP wants to increase his statin medicine. During the conversation, Dr. Tom discovers that Reggie is not using the antihypertensive that he prescribed several months ago. He's not using it properly because of a misunderstanding. Reggie hadn't clearly understood the differences between the blood pressure medicine he was supposed to take every day and the other pills he was supposed to take for atrial fibrillation and angina only when each was needed. From his point of view, they were all heart pills. Dr. Tom wants to sort this out properly using our new software to generate a clear summary to hand to Reggie. Based on the clinical notes that he wrote during the consultation, Dr. Tom can generate a patient visitation summary. Once this report is generated, he can review the summarised report, make any modifications he wants, and then approve it before it is given to the patient. This shouldn't add much time to the consultation and will save more time in the future. Together they go over the summary, ensuring that Reggie understands his treatment plan, the importance of his medications and the next steps. Reggie can opt to have a printout version that he can take with him, or he can view it through his online patient portal. The report includes information such as the patient's condition, their medication, as well as what each medication is for, a summary of what was discussed at the consultation, things the patient can do to manage their health, and next steps and follow-ups. Reggie now feels much more confident about his health management. He knows exactly what each medication is for and can refer back to this summary to help him remember any follow-up appointments.